or medical school, probably I would not have shown up. So thank you. And honestly, Lana and Yasmin, thank you so much. It is so fun to see young people who are entrepreneurs. The fact that you guys are doing this already in your lives is amazing, because at 50, I'm just becoming an entrepreneur, really. And it's a lot of work and it takes so much motivation. So this is awesome. And it just like is power to your generation. I think your guys' generation gets a bad rap sometimes. And I am happy to say, seeing people like you gives us all hope. So thank you. So I am going to give you guys I think maybe a different, I don't even want to call it lecture, but talk than most of the other doctors, because I saw that a bunch of people had PowerPoint slides and I just don't have them, because this isn't stuff that needs PowerPoint for me, because I'm going to talk to you about me and my life and what I feel really strongly about. And I'm hopeful that this will kind of not only help introduce you to OBGYN and to what it's like to be a mom and a doctor. And like, I'm literally up in my attic. I don't know if you can hear, but my dogs are walking around my attic because this is my day off and this is how I have to do things. So I want you guys to kind of understand that you don't have to do all the traditional things. So I started out really as like a smart enough kid, probably like everyone here, but unlike many people on this feed, I was not that type A kid. My older sister was always wanting to be a lawyer. She's now a judge. I came from an immigrant family like Yasmin, I'm Iranian. And the assumption was that we were going to work hard and get good careers. But I was all over the map. In high school, you know, I did well enough, but everyone knew I liked to talk. I liked to have fun. I did not take things seriously. And then I managed to get into Georgetown by, you know, my sister being there, some other connections. And I switched majors 4 times as an undergrad. So I had no idea if I wanted to do anything specific. I did not want to be a doctor. My parents were doctors. And in my mind, medicine was really amazing, really hard work. They were very clear that if you don't love it, you should not do it, because they're right. It's super hard work. And I just wasn't prepared for that. So I would say, I want to go into business. I want to go into fashion. I mean, anything other than medicine, not as a way of just retaliating against them. They loved it and they were very open with us, but it just didn't seem like anything I wanted to do. So 4 different majors as an undergrad. And halfway through senior year, I was like, I have no idea what I'm going to do. Maybe I should just take pre-meds to see. I mean, it was literally like that type of trajectory. So unlike many of you who might have always thought you wanted to be a doctor, I'm wondering if there's some of you who kind of felt like, I don't know if it's what I'd like. And I'm here to tell you that even if you're not sure, it can be something amazing, but maybe not for the reasons you thought. Like, I've ended up loving medicine, not because I love science. I hated my pre-meds. I hated physics and general chemistry and organic chemistry. They have nothing to do with being a physician. Not once in my career in 21 years have I used physics or organic chemistry. Not once. I would say not even biology, really, because what they teach you in undergrad biology for pre-meds is not applicable to medicine. So the good news is, suffer through it. It sucks. Work really hard. Get as good grades as you can. Go to medical school and you will be a doctor if that is what you want. What I love about being a doctor is getting to engage with people every day. Like, I have 30 to 35 people a day in my office, in my face, that I have to engage with. And that's what I love about it. So for me, it's been a great medium through which I can do what I want to do. But that doesn't mean it's the only thing I could have done, which is why now in my career, 21 years into it, I'm still going to practice, but I'm also going to do entrepreneurial things. So as an undergrad, like I said, 4 different majors. As a pre-med student, I was lucky enough to get into the Columbia Post-Bac program when it started back in, this was in 1992 when I did it. But it was such a grueling program that even through my pre-meds, I had a bunch of missteps. Like, organic chemistry was impossible for me. So I think I ended up getting maybe a B- or a C+. It was a low enough grade that Columbia wanted to kick me out. So I want you guys to know these things, because people you now see as doctors who are doing well, who are successful, who love it, who are actually getting, you know, who know their stuff, have all had, or many of us, not all of us, I guess, have had these trials and travails. So I almost got kicked out. I had to beg them to let me stay. They agreed to let me stay. I went to medical school, and I know there's questions about MD versus DO, so I'm going to touch upon that. I applied everywhere, but I was already 3 years out from undergrad. So I did 2 years of pre-meds and then that 1 year to apply. And during that 1 year, I worked in a lab. And I learned how much I disliked science, working as a bench researcher in a lab at Cornell in the city. But I had 3 great years where I got to spend time with my best friends. I got to travel for 3 months. So I know that Yasmin and Lana and I have been talking about taking a gap year. And I can't say how much I encourage / wish we could force people to take a year. either to work somewhere, maybe related to medicine, maybe not, or to travel or to take a class that's unrelated to medicine. Because the rest of your life, I don't want to say like, that's it, the rest of your life, you're screwed and you never get to do these things. I still get to enjoy a lot of things, but it's not the same type of freedom. So I would encourage you to do it. I'm glad I did it. I don't regret for a second that I had this like winding wayward path of getting to where I am, because 21 years later, I'm still a doctor. And if it had been 3 years earlier, that was not going to help me at all. So I went to medical school in Tel Aviv. So when you guys apply to medical school, and from what I keep hearing, it's getting even harder to get into medical school than when I had applied. I had applied at a time where apparently when I started the post-bac pre-med program, their acceptance rate was like 80 to 90%. And by the time I finished 3 years later, their acceptance rate was like 30%. And as an older student, I had the choice of saying I was either going to apply to medical schools only, including medical schools abroad, or MD and DOs. I think they're equivalent. And I know that because in my practice of 4 doctors, and knock on wood, we are lucky enough to be actually the busiest practice in our area. And I don't say that to brag because I joke, we are not the smartest doctors. We are just super nice to our patients. We like talking to our patients, and that's what patients really want. We need to be smart enough to really know our stuff, smart enough to know when to send patients to specialists, and we need to engage. And that's really what patients want the most. So 2 out of the 4 of us are DOs. So my 2 male partners are DOs. I have another male partner who's an MD, and then I'm an MD. So out of the 4, we're 50-50 split. And out of the 2 MDs, I went to medical school in Tel Aviv at Sackler, which is the only school at the time who was considered an American school, but it was still a foreign school. And my other partner, my senior partner who opened our practice 35 years ago, went to Tampico in Mexico. I don't even know if it exists, like somewhere I've never heard of. And literally, when I tell you, the 4 of us are lucky, we really care about each other, and we're lucky enough to have a good practice. So my biggest pieces of advice, unless you want to go into research where we know it's really important for you to kind of have fancy names, but if you want to be a regular practicing physician and clinician, it really doesn't matter where you go. I've seen the smartest, best trained, Harvard, Yale doctors who have no bedside manner, and they don't end up enjoying it, and they don't end up doing well. And I've seen some of the, like the schools I've never even heard of, and they do really well because they're willing to engage. Patients want our attention, and they want to know that we're actually listening and that we care and that we're not hiding behind the computer and things like that. So just to touch upon MD versus DO, I think they're both equivalent. I think they're both great. I came from a family where there were 2 doctors that were MDs, so it just seemed easier because frankly, like having to explain myself to everyone in the world was annoying to me. But honestly, I don't think it bothers my partners at all. Most of my patients who are many of my friends see my 2 partners, they don't even know that my partners are MDs or DOs. They don't know the difference. We make fun of them a little bit, and we'll say things like, you're really an eye doctor, but we just do that to be silly. We don't care. It's very equivalent. So that's one thing. Foreign grad versus American grad, I'd say similarly, people were very worried when we were all in medical school about trying to get surgical subspecialties. And I'm an OBGYN, which is a surgical subspecialty. I have a ton of friends who went into surgery itself or OB. I have a ton of friends who are subspecialists, meaning after internal medicine, they ended up being infectious disease, oncology. So again, where you go to school nowadays, really, I would argue doesn't matter as much unless you're doing something purely academic like bench research where you really need a good MD, PhD. Outside of that, it does not matter. So medical school is just a crazy, grueling time. Like hearing you guys talk about your MCATs and all those exams, it gives me a little bit of like, I get that chill down my spine. The one thing I will say is you will persevere if this is what you want to do. If you have to take your MCATs more than once, if you end up, losing out 1 extra year of going to medical school because you didn't get in or you didn't get in where you want, my biggest piece of advice to all of you guys now as a 51-year-old woman is, don't stress out about that stuff. Like in the long term, it feels like it means so much right now, but it does not later, I promise. So flashing forward to medical school, then I was lucky enough to get a residency in Stamford, Connecticut, here where I now practice. And it's a great experience if you're sure that you want to do, again, clinical medicine, meaning in a practice. Being at a university hospital is, of course, amazing because you get so much exposure to different names of people who are doing a lot of research. But being at a community hospital, like the place that I was better for our training because we didn't have fellows. So we had Columbia medical students, we had us as residents, and no fellows. So we got a ton of exposure to all of the daily, like the surgeries and the cases. And we had a great clinic population. So that's jumping forward to when you guys want to go through residency, and you don't need to think about that yet, but it's just a little nugget again of you kind of plan what you think you know you're going to do. And ultimately, if you keep your mind open enough and you know which part of your personality you want to hone, then all of these things are really going to work out. Like I could have ended up in a totally different place. I still think I would have been happy because what I liked was engaging with people. So figure out what aspect it is that you like. And honestly, you'll be able to find that wherever you go if you stay open-minded about it. There's a lot of questions I know about being a woman, being a mother. How do you do it? I actually joke that like when people say like, how do you balance it all? The answer is like, I'm never balancing it all. But I'm able to do a ton of things because I'm also willing to give up a lot of things. Like I'm not one of those people who cares if I clean my own house. I don't clean my own house. I don't do my own laundry now that I can afford it. When I was younger, I had to do it. I'm not one of those people who feels like I have to be the one to like make lunch for my children every day or any of those things. Like, cause I've realized that that's not my forte. I give that up. So again, a lot of these questions have to do with what you want yourself personally. I say to my female patients all the time, we all have to figure out what it is that we like and that we're good at and that we want to spend our time doing. And we have to divorce ourselves from stressing or worrying about whether or not we should be doing all the other things that people in society expect us to do, because people in society is us. And as women, I don't know how many men are on this feed, but you guys can hear this too. If you end up getting married to a woman, if you end up being a father, women on this feed, if you end up deciding that you want a mother at all, we're the ones who are driving the bus, and we're not always driving it that well. We are actually discouraging women from doing whatever they want to do themselves. And we're making women feel as if they should be doing all the things that everyone else does. And I think that's frustrating. So that's one thing I wanted to say. One other thing I also want to say is just, I don't want everyone to get that stressed and worried. Sounds funny to say this as an OBGYN about their fertility, because when you go into pre-meds in medical school, you're going to hear a lot of people asking you like, well, do you think you want to get married? Do you think you want to have children? How are you going to do this all? And the answer is millions of women have been doing it. You're going to get it done. You're going to get it done with some sacrifices, just like any other field. But the payoff is that on a daily basis, you get to truly feel so fulfilled. It's sometimes frustrating. I mean, at 3 a.m, I'll be driving to the hospital and I'll joke that I have to be like, God damn it, I'm so tired. And then on the way home, I'm like, I'm so fulfilled. It's such a great job. So there are times where you're exhausted and stressed. So when people say, how is it to be an OBGYN? It is amazing and wonderful and fulfilling, and everything about it is so just dramatic and exciting, all these things, and yet it's exhausting and stressful and horrible, and like it's both. And I think that's kind of the hallmark of any amazing field, right? I don't think anyone has a career that I know who doesn't feel that way. And I think the people who are either purely thrilled are probably lying, as I call them. There's unicorns or liars. There's the unicorns out there who just think everything about their job is amazing. They're able to make enough money and not have any stress. I don't know anyone like that, but I'm sure they exist. And then there's the liars who won't tell you the truth. So I think it's important for us to be clear. When you go into OBGYN, you have to accept that you will be giving up a fair amount of things. Like I am off for Thanksgiving, but I'm on call for Christmas. And this is now as a 51-year-old woman with 3 kids who's been in practice for 21 years. And it's not because my partners are jerks. It's because the 4 of us share our call and we rotate. So that means that every year there will be certain holidays I give up. I'm not always home for my kids' birthdays. I'm not even always home for my own birthday. My husband and I joke that we don't know when we're going to celebrate our anniversaries, things like that. So there are things you will give up. I've given up on sleep a lot. It's surely affected my health, I am sure, because I don't get to exercise the way I should. That said, I get an emotional satisfaction. I mean, every day you come home from work as an OBGYN and you're like, oh, I did good today. Like literally, you did good every day. And that is such a beautiful, fortifying thing. And if you love what you're doing, you really will be able to help people. Like women want information from us. And if we're willing to do it well, then it's great. The differences in practice. So there were some questions about practice. How do you practice and what types of practices are there? So in general, you can go into private practice, meaning you are self-employed or employed by a practice that is not employed by anyone else, or you work for a university practice, or you work for a lot of these big new companies. Like in this area, there's Caramount, there's WestMed, there's these huge companies. Like in California, there's Kaiser, and they employ physicians. So they're multi-specialty practices. I'm part of a private practice. We are a little bit of a dinosaur and unusual, because to be in private practice means you have to run your business as well. And that is challenging. But again, like anything else, it comes with benefits. So my partners and I run our practice. We own our practice. If I'm going to take a day off, I'm taking a day off. It's taking away from what I bring in, but it doesn't matter because that's our choice. So while we don't have the cushion of someone else employing us, someone else giving us health insurance, someone else making sure that they find us a secretary, I also don't have to answer to anyone but myself. And my partners and I collaborate. We love each other. We take care of each other. And that makes a big difference. So to me, a private practice is great. That said, the easier route in a way is to be employed by a university practice or a big practice because they take care of everything and then you just show up to work. The downside to just showing up to work is you've lost a lot of your freedom. They'll tell you whether or not you can take a day off, when you can take a day off, whether or not you can see 2 patients instead of 10 patients. And that's the type of thing that to me is really important. And you guys will have to see as you go down the line, what you end up doing, what you end up liking and what resonates with you and what practices you might hear of. Like I was lucky enough to stay in our town because I knew my partners and I knew that I wanted to work with them because I saw how they worked. They love each other. I think there's a lot of doctors who finish school, and unfortunately this does seem to happen more with women who are potentially in a relationship where their husband's job seems to dictate where they go. And then unfortunately those women are at the mercy of picking practices that they've never met and just kind of looking at the lifestyle aspect, like working 3 or 4 days a week, having a decent salary and not having to worry about anything else. But then they find themselves stuck in practices where they really don't like their partners. And I think that is, as you guys can probably guess, if you're working all day, every day in a field that is incredibly gratifying but stressful, if you add to it fighting with your partners or not feeling like your partners have your back or feeling like in our world, your partners have dumped deliveries on you, it really makes things worse. So my other nugget of advice is no matter what you do, what field you go into, the work is so important, but the work is a small part of it. It's how you're working, who you're working with, the environment you're working with, the people you're working with can make such a difference. So I can't stress that enough. I see the other people in our area and many of the other practices hate each other and that trickles down. So I think that really makes a big difference. And I like urge you guys to find people that you really like. So jumping ahead a little bit to my journey. So I finished medical school. I went to residency. I took 5 weeks off between residency and starting my practice, which was great. I joked like I was going to learn how to sew and I was going to learn a language, and I ended up doing none of that, but it was a great 5 weeks off where I had no responsibility. I didn't yet have children. And then residency for OBGYN, you guys probably know, is 4 years. Back in my day, we didn't do 80-hour work weeks. We did about 110 hours. So it was grueling. But by my second year of residency, I had decided that I would think about getting pregnant. And then I got pregnant like right away without really meaning to, which sounds silly. And that started a kind of course of pregnancies and miscarriages that was challenging. So again, I use this as an example of, first of all, from a physician point of view, we're not immune to going through stuff. And in fact, it humanizes us and helps us when we go through things. All the things I've gone through as an OBGYN have only helped me in my practice. Second of all, whenever you guys go through something, which inevitably I always say, we're all going to go through the shit. Something's going to happen to all of us. Remind yourself you're going to get on the other side of it at some point, no matter how bad it is. So in that moment where I was going through, I had miscarriages, then I had a child who is now almost 17, but he had had an intrauterine stroke towards the end of the pregnancy that we did not know about. He's ultimately fine, a little quirky, like many of us. I then had 4 more miscarriages, another baby who had a club foot, which is where the foot is completely turned in. He's ultimately fine. He actually plays soccer really well, but that was a whole process to get that fixed. So through this all, I would keep joking like, okay, God, you're going to help me relate. What do you, tell me what I need to be doing to relate, and tell me if, sorry, I'm trying to get out of this thing, you guys, and tell me, if there's anything else that I need to look for, because I would really rather not keep relating to people like this. Like I can totally empathize with what everyone's going through. I don't need to experience it all. But the truth is, experiencing all that really helped me as an OBGYN. I understood what it was like to go through miscarriages, to go through a really challenging vaginal delivery. I chose to have 2 C-sections after that. All of this helped me in my journey to figure out how to bond with my patients and what aspect of being a woman and going through these issues is really important. Everyone can learn the basic science. I mean, I always joke, like, all you need is like half a brain to be able to really learn a lot of this stuff. Being an OBGYN from the clinical perspective it's not incredibly challenging. It's not like nephrology, right? That said, to be a really good OBGYN, you have to connect with people. If you don't like talking and connecting with people, to me, this is not a field for you, because that is what it requires to do really well by women, to just kind of check off the box and like do a pap smear. I mean, I joke, I could teach anyone to do a pap smear. I could teach my 17-year-old to do a pap smear. That's not the challenge. It's how you deal with the pap smear, how you know, garner a woman through her exam when you can tell she's feeling a little bit uncomfortable, or there's so many different aspects of it that you need to draw on your life experiences. And then after having my babies, I went through weight loss surgery because I had gone up to 250 pounds. And that was another thing that has still been a struggle for me, but has really helped me talk to patients through these things. And it doesn't mean that I kind of advocate for everyone to do that. It means that I really try to get women to understand that we are all so different, and yet we all have the same pain points. And then the culmination of all the health stuff, let's hope that was a culmination, is that I had ovarian cancer 4 years ago. And in that moment, when I was told, turns out it's cancer and you have to have chemo for 16 weeks, I remember thinking, all right, well, there's like life before cancer, life after cancer. Suddenly that minute, it's life after cancer. I'm lucky enough that I'm a doctor. I'm lucky enough that I know the surgeons and I know what the chemotherapy is, and this is my field and this is my jam. And when I walk into the hospital for chemo and all my friends come with me, I know all these nurses. So you guys have to figure it out, whatever it is in your world, whether or not you become a doctor, whether or not you become an OBGYN, when things happen, there's always going to be something about it that isn't crappy. And if you're an optimist, you can look at it as, what aspect of this do I love, and what aspect of this is going to give me something back? So in my world, I thought, okay, I don't want to have ovarian cancer, go through chemo. That said, I do love connecting and talking to people. It's fun to be in a hospital where I've known everyone for so many years. They're going to help take care of me. I'm just going to like suck that up. One of my children in particular is not an optimist. So I have to frame things with him and tell him to remember to look for the things that don't suck in that moment, right? So like the flip side is I could have said, well, it doesn't suck that I actually got to be home for about 5 weeks after 2 big surgeries and rest, which sounds crazy, but that's the world of an OBGYN. So when you're working so much, resting and convalescing at home and having all my friends and my family come bring me stuff wasn't so bad, right? So it's like anything in life. Right now, you guys have to look at, like, the pandemic sucks for you guys. I really do feel, and I see the college students who come into my office, and I'm so impressed that they're not acting completely whiny. It's really impressive. So you guys obviously have the ability as a generation to do so well. And I feel like if you guys can keep up in those moments where things suck, remind yourself of what doesn't suck that bad, even if it's the dumbest little thing, like it doesn't suck that bad that, you know, you have a roof over your head, like those dumb things, that can always frame things really well. And I know it sounds corny, but I feel like I put my money where my mouth is, because I have used that theory without even meaning or knowing to. And it's only helped me build my resilience to be able to deal with stuff like, you know, ovarian cancer, losing all my hair, going through chemo. I had tons of surgeries because there were complications from the surgeries. So a lot of that stuff is, it's challenging, but you guys can get through it. So again, residency, 4 years. Then you decide if you're going to do a fellowship or not. For OBGYN, you can do fellowships like fertility. You can do perinatology, which is high risk OB. You can do urogynecology, which is where you deal with the pelvic floor. You can do, what's the fourth one? GYN oncology. And now there's minimally invasive surgery, and there is a family planning one where you do terminations and things like that. So I think fellowships are also amazing if that's what you love. I knew I didn't want to do it. I knew I loved general OBGYN, and I was also already a little bit older, so I didn't want to do that. I think the choices are something that if I were you, I wouldn't think about yet. I'll tell you the truth that I don't know if I mentioned this, and I think I did. I did not only did I not know I wanted to be a doctor, when I got into medical school, I was like, well, this is good. I mean, I'll work hard. This seems fun. I like talking to people. You know, I know my parents' life was pretty good. I know I like to do a lot. I like to travel. I like to have things. This will provide me a nice lifestyle for that. And I was willing to work hard. It turns out that it's become so much more. But even through medical school, I had no idea that I wanted to be an OBGYN. My mom was a pediatrician. I thought that seems like a great field. And actually, I can work really hard and still sometimes be home. My dad was a general surgeon. I thought that was amazing. I operated with him as a pre-med student sometimes, and it was so much fun. Back in the day when they'd let us do that stuff. They wouldn't let you guys do that anymore. But it was so fun, and I loved doing things with my hands. So I loved both of those. And that's what I thought I would do, because again, I was a little bit lazy in what I was like willing to explore. And then I remember people saying things like, you should be a dermatologist. You're a woman. Have you thought about going into dental school instead because you're a woman? And it was so offensive to even think that, because I thought, okay, as much as I don't want to work a ton like everybody else seems to want to, I'm willing to work hard. I'm here. I'm not going to just pick what is convenient. I'm going to pick something that seems like I love. And I loved being a pediatrician or surgeon. I thought gynecology was disgusting, actually. I don't know why, but in my mind, I was like, it just seems gross, which now seems so immature and silly. And if someone said it to me, I would be not offended, but I would think like they clearly don't know anything about it. But then my rotation OBGYN was amazing. So again, my biggest piece of advice is if you're not sure what you want to do, or you're sure that you do want to do a specific field, that's great, but stay open-minded because you really don't know. The reason I loved my OB rotation was that the doctors who taught me happened to be so much fun. They were super engaged. They allowed me to do a lot. I remember doing a triplet C-section as a medical student, like must have been my third year rotation. They allowed me to do a huge amount that, again, in America would not fly, and certainly nowadays in 2020 wouldn't fly. But it really helped me understand how exciting it was, that it was actually a formation of general surgery and pediatrics conglomerated into one field. Because now I get to do surgery and I get to be the primary care doctor for my patients and get to know them through their whole life. So it really melded both fields, which is why OB to me is the best of all fields. And when I say OB, OBGYN, I'm just truncating it because it's easier to say. OBGYN is so great because you get to do surgery if you like surgery, and doing procedures is, to me, just exciting and fun. And you get to bond with your patients. And once you're in practice, you also can modulate how much you do each of those. I actually now do less GYN surgery, not because I don't love it, but because it's just really, it's challenging to get into my schedule. So I do a ton of surgery because we're still doing a lot of C-sections. I do minor surgeries for GYN. And then two of my partners who love to do the robotics are the ones who do all the major surgeries. I happen to love being in the office and actually getting to engage with our patients on a daily basis. So that's the part that I put more time in. So even within it, you can morph and change. Now more than ever, medicine has changed because you guys see so many of the doctors who are on social media are doing all kinds of things. Like I'm actually this week launching a company. That's my tribe called V, which is going to have a pregnancy kit for people to do a telehealth visit, not for my own patients necessarily, but countrywide, whoever wants to do telehealth visits with their doctors. And I wrote an ebook for it about pregnancy. So it's going to have the ebook and a private Facebook group. And there's a separate model within it that's going to be a membership site for people to learn all of the gynecology stuff that I find women don't get to learn about, like HPV and herpes and, perimenopause and contraception, all these things that they don't necessarily learn and the doctors don't always have enough time to talk to them about. So that's something that I never knew I was going to do that until last year. I didn't know I was going to do it. So I'm still an OBGYN, I'm still a doctor, and yet I can morph my practice and do things differently, which isn't something the past generations could do. So again, this is all to say, keep an open mind with regard to where you're going to go to medical school, when you're going to go to medical school, what field you're going to pick, and how you're going to practice when you get out, because it can all change. I don't know if you guys have heard of birth plans, but many women will have what's called a birth plan, which is where they write down exactly what they want to happen during their labor. And I'm always like, okay, who thought that you could plan this? This is the most unplanned thing. How about you just tell me that in the end, you'd like to have a happy, healthy baby and that you would like to be happy and healthy, and we will achieve that. And I have no idea what route it's going to take. It's actually just like that, I think, for your life as a doctor. When I was sitting where you guys are right now, so most of you are like third or fourth year college, right? Third year college, I was still having fun. At that point, I was an English major, and then I switched to become a government major. So I had zero idea I was going to be a doctor. Senior year of college, I was like, I guess I'll apply to pre-meds. I start taking my pre-meds. No idea where I'm going to go to medical school, whether or not I'm going to finish, whether or not I'm going to get in. So again, there are so many points along the line where things might change. And honestly, if you work hard and you pay attention to the things that you learn you like about yourself, that is where the magic will happen and you'll figure stuff out. I promise, promise, promise. Okay, tell me if there's anything specific. If not, I was going to go through these questions that you guys had asked. So Yaz and Lana, do you always want to figure out if there's anything specific, or should I go through? Because a lot of these...
I would say a lot of the questions are pretty relevant to the list that we gave you.
Good. Okay. So balance is my personal life with working. Is it harder for females than males? I mean, are there any males on this? Because let me tell you, hell yes, it is much harder for females than males. That's just a fact. I think our biology is beautiful and amazing and challenges and limits us. Like my three partners are men. I adore them. They all three have wives who stay home. They all three have 3 kids as well. Whose life is harder? I mean, it's just a fact. I hate to say it. Like I have to do every single thing they do in the office, and I had to create and birth my children, right? And my husband is wonderful, and he actually is home much more than I am, and he does much more than most men. But I also work as much as, any man in my practice, and I'm still doing a lot of the mothering. So it's definitely harder. Like, you can't go into this field wanting to be a mother, wanting to be a doctor, and thinking that you're going to do all the things a full-time mother would do. Which I actually don't even think we should do that anyway, but that would be really challenging. And if that's your intention, that you're going to be a full-time doctor and still like be the one to bake the cookies and be the president of the PTA, it's probably going to be challenging. You could still do it, but you might have to really morph your practice. I would not have time to do those things. Those aren't things I like. Those aren't even things I think would be valuable for my children. But I still spend a ton of time with my kids when I can. And the time that I spend with them truly is more quality time. I'm not the one who's driving them to every activity. I'm not the one who's like sitting and doing their homework. And that's worked out for us because I've kind of guided them in a way where they understand that their independence and their resilience is very important to me. So I don't want to be the one doing all that. I want to groom them to be able to understand and appreciate, who they are and where they fit into our society. And they know that I am there and that I will do anything for them. But I also want them to actually learn how to traverse a lot of this stuff on their own. Because if they don't learn that, then when they become the doctor who didn't get into medical school, like in America, or they become the doctor who ends up having miscarriages, or the doctor who has ovarian cancer, then their lack of resilience is not going to help them get through all that. So I actually think as women, the mistake a lot of women make is having their full-time career and then trying to be the equivalent of a stay-at-home mom. And that is like, it just causes so much anxiety for those moms, and it's not helpful for the kids. Okay, so an OBGYN call schedule can be incredibly different. So this question is, what does an OBGYN call schedule look like? Again, it very much depends on how many people are in your practice and how many of them do OB. In our practice, we have a very unique schedule because it's 4 of us, and one of the oldest doctor just decided to stop taking call last year. So the 3 of us had to split call. We used to do Q4, meaning every 4th night and every 4th weekend we would be on call, and we would work the next day. And so sometimes that would suck. We each had 1 day off. So I'm always off on Tuesdays, for example. When our oldest doctor stopped taking call, we couldn't switch to Q3. It was too grueling. We actually have enough patients in our practice to probably have a 4th and 5th doctor delivering with us. So instead, as the woman, I designed a schedule where we each do 1 straight week of call. So I'll have 24/7 for 7 straight days, from a Sunday to a Sunday on call, with no office duties that week. And then I'll have 2 straight weeks where I'm on call, but I'm in the office, but I'm not on call. And actually, a lot of the other doctors in our hospital have seen that we're doing it and are thinking about it. And it actually has helped our lifestyle so much, because that 1 week of call, you might be home at time, you might never be home. You might be up like I was up last week. 3 nights I was at the hospital basically all night long, but 4 other nights I was in my bed. And during the days, I had a combination of actually driving the kids to school occasionally. It was a crapshoot. I didn't know when I was going to be around, but it actually allowed me to spend time with my patients in the hospital without running back and forth to the office. And then the 2 weeks in the office, I'm only in the office and I'm doing surgeries in the morning. So I get to sleep for 14 straight nights in my bed. I would say the average doctor doesn't do things like that. Most OBGYNs will be in a practice of, anywhere from like 2 to 7 people, and they'll share call. And they'll often do like shifts, like 12-hour shifts, for example. Or if you're an employed doctor by the hospital, then we have what are called hospitalists or laborists, who only work on labor and delivery. And I have to say, for a lot of the women who are younger, who are having children earlier and don't want to be in a private practice where it's busy, it's a very manageable lifestyle. They do 12 to 24-hour shifts. They do like 6 to 8 of those a month. And they get a decent salary for that. It's, again, not something I would want to do because they don't have the same continuity. And I don't feel like they're kind of building their muscle of learning a lot. But I'd also say I really do try to reserve judgment, because we all have different intentions, and they definitely get to be home more with their children. And that's really important to a lot of them. So the good news is, again, you can morph your practice to do what you want to do. There really is, it's so not one size fits all. Like when my mom was practicing, years ago, she really had to just do one thing, and things have changed so much. You can be very different. What trends do we see OBGYN heading towards? I would say the trend I see the most is that the young physicians don't seem to want to do general OBGYN. I feel like almost everyone is doing a fellowship, and it makes me a little bit sad, because I feel like general OBGYN is great. I think they're doing it mostly either because they're not sure what they want to do, so they're kind of pushing things off a little bit, or they do think that doing one of the subspecialties will probably give you a better lifestyle, which it can, depending on how you frame that lifestyle. In other words, if you're a fertility doctor, a reproductive endocrinologist and fertility doctor, REI we call it, you likely don't have to go in the middle of the night very much, whereas I go in all the time. On the flip side, you also don't get the same continuity with your patient. So it just depends on what aspect you like. So again, I'm going to keep saying this. It's good to be flexible. How do I deal with moms? Well, this one I'm not going to address yet, about moms with unhealthy lives. How did I decide that I wanted to be an OBGYN? We talked about that. I didn't. I was like, oh, I love surgery. I love this. I'm going to do it and let's see. And it ended up being great. What steps should current medical students take in years 1 and 2 if they know they want to go into OBGYN? Well, I'd first say, I don't know how people would know it, right? I think it's great to think you know it. I think it's great to do things like this, talk to a bunch of different doctors. And then I actually think that just figure out like where your interest lies and go with it. I mean, this sounds crazy, but I actually think we put people in such a pigeonhole and we create a lot of angst for young people by saying things like, where is your passion? What do you think you want to do? Like, you have to find something you're going to be happy in. I actually would argue that we should do the opposite. We should figure out where your strengths are. There's actually tests you can take. There's one called Strengths 2.0 where you really figure out your strengths. I wish I had done that when I was younger. And then you kind of go, look, there's like 30 things that would fit into my strengths. Let me pick one of them and I'm just going to work hard on it. And I guarantee you, if you do that, you will find love within that. Like, I love OBGYN. I could have loved being a talk show host. I could have loved pediatrics. I could have loved a lot of different things because I decided I'm willing to work hard. And what I actually found that I love is engaging with people. I think it's really rare for people to like only like the field of OBGYN because they like it, or only like oncology because they only like cancer cells, right? There are aspects of it that they believe they like, but they are pigeonholed into thinking that they have to like this one way of it. If you started OBGYN and then you realize like, I don't know, I just don't like being on call at night. It's exhausting and I don't bounce back anymore, then you morph and you change. So again, it sounds like kind of, I don't know, like something that people can't really do, but you really can do that. You just have to have the right mindset and attitude where you're going to stay with something as long as it's not making you miserable. If it is making you miserable, you should switch to something else, or within it, find something you love, because you can find the joy in all of these different fields. I think OBGYN is great, but honestly, I think all the fields can be great if you love them, and you can morph what part you love about it. You just have to be creative. I know that sounds fuzzy, but I swear it's true. So I think if you really do want to get involved in OBGYN, go to your mentors, like talk to them, do things like this where you talk to different doctors. So you just get the idea of what I'm saying, which is there's a lot of different ways you can be an OBGYN. It does not mean one thing. Right now, I can tell you like 5 of the female doctors at the hospital, and we all have totally different lifestyles, completely different lifestyles by choice, right? And so that's a good thing. We all gotten to do what we want within it. We talked about DOs versus OBs. What's the most challenging aspect of being an OBGYN? Lord, there are so many, but one is just staying up late is really tiring and grueling after a while. And I am getting to the end of my rope. I'm 51 and I feel like I love it. I don't ever want to stop being a doctor, but I don't want to be up in the middle of the night anymore and have this like not know what's going on, which is why I'm building a separate business so that I can do just GYN, which I happen to love. My partners would say they'd actually rather do just OB and like robotic surgery. That's it. They don't like being in the office. They're amazing men, but they don't particularly love talking about like vaginal discharge all day and things like that. I could talk about till I'm blue in the face because I know it's not the discharge, it's how the discharge makes us feel as women, right? So that's the most challenging thing. Is one is the sleep, the lack of sleep. 2 is actually, I hate to even ever talk about malpractice because it's so egregious, but the fact that we do really hard work, I don't know any OBGYN who is like malignant or mean or trying to harm women, and that indirectly, sometimes things happen that we cannot control. And increasingly, there's this notion that is like perpetuated by the internet and Instagram that, women need to take back their health and fertility and birthing and kind of empower themselves against medicine. And it's frustrating as a woman who's very, very, very feminist. I feel frustrated that it's become this anti-feminist movement where women have been made to feel they can take back their health in a way that actually is really damaging to them because they're being advised by people who don't actually understand, for example, labor and how erratic labor can be and how dangerous labor can be. It's not usually dangerous, but it can be, and it's unpredictable. So they're kind of encouraging women to take charge and adversarially go against their doctor. And that doesn't lead to a great relationship. And so unfortunately, that aspect is something you have to manage where you realize that people are going to learn things that aren't necessarily true. They're going to try to manage their own care. You have to gently guide them and make it clear that you want to help them in their care without being paternalistic and dogmatic. So you end up, I feel like every day is this emotionally exhausting dance of working really hard at knowing what I know, but also trying to manage how I am metering this information to women where I don't come off as the doctor who's telling them it's my way or the highway, but also not allowing them to rule things, because at the end of the day, I have to take responsibility for it. I have to take responsibility emotionally. If I have a bad outcome, it hurts me emotionally for my patients. And unfortunately, I have to worry about the malpractice aspect. And so that I can see how over time OBs get a little bit bitter about it, because they know that we're the ones up at night in the middle of the night. So the thought of being blamed or sued for something that was really out of our control just seems like an extra kind of salt in the wound. And I don't know if that's ever going to change, or at least not in the next like 15, 20 years in America. I want to answer about the OBGYN, and then I think we should talk about just what's happening with Black mothers in America, because it is a big challenge. So can you practice OBGYN equally? You can do it equally, you can do it separately. You can do a little bit more, a little bit less. I would say if I added up all my hours, I probably do as much OB as GYN, because I have that one full week of only OB. But if you look at my practice roster during the day, out of 30 to 35 patients, I see probably 20 to 25 GYN and only 10 or 15 OB, because I tend to love the GYN, and my patients, especially as the only woman in the group, they want to come to see me for a lot of the gynecology stuff. But my partners tend to see more OB. So that's another part. Like, you can really morph and change it to do what you want to do. You could practice only OB by being a hospitalist. You could practice only GYN by giving up the OB, which is what I'd ultimately like to do, and only see women in gynecology. There is an interesting concept. A lot of women are like, well, I'm done having babies, so it doesn't matter who I go to anymore. And I always say, like, this is a crazy concept, because as a woman, you spend more of your time not pregnant than pregnant first. And actually, first and even more important than that, I think, once again, women are very pigeonholed. I say very frequently and very vocally to my patients that despite being a mother and despite birthing children for, part of my living, I don't think that everyone needs or should have children. And not because they're not equipped to have children, or not because it's selfish, or not because they're not going to be good mothers. Some of the most amazing women I know would be amazing mothers, and they've chosen not to have children. And I think it's awesome. And I really, like, my own daughter, who's 10 almost, has said things like, "Ugh, it just looks really painful to have babies. I don't want babies." And I'm always like, yeah, you don't have to have babies. See what happens. Like, you're only 10. If you want a baby, have a baby. You don't want a baby, don't have a baby. Like, you will be happy if you make yourself happy. Being a mother, being a wife, being a doctor, those are not the things that are going to make us happy. The things that are going to make us happy are finding what we are passionate about and what we love. And again, even using the word passion makes me cringe a little bit, because I remember when people said, like, well, what's your passion? I was like, I don't know. My passion is like to have a job I like that pays me well so that I can do things I enjoy. How's that? Like, that was my passion. It was broad. And it turns out my passion is, again, engaging and talking. I get to do it through medicine, but I could do it through other things. I love being a mother, but I actually know for a fact that I would be just as happy if I were not a mother. Now that I am a mother, I can't imagine life without my children. But had I chosen never to be a mother, I absolutely would have been as happy, because I would have been fulfilled in other things. And frankly, a lot of the angst and stress that mothering causes, I wouldn't have had. So it's not better or worse. It's merely different. And our society still very much pigeonholes women into thinking that you can have everything and you can be a doctor and be really happy. But are you having kids too? And the answer is, have a kid if you want to have a kid. And if you're not even sure, I would actually argue, don't even set your mind to, I want a kid or not. Just like, don't set your mind to, I'm going to be an MD or a DO, or I'm going to be an OBGYN or not. See where the path takes you. And if you really engage in your path, you're going to be happy. And if you're engaged in your path and you're happy, and that leads you down the road of having an amazing group of friends, wonderful partner, and a great job, then actually studies show you'll be happier than the people who had children, by the way. There's data about this. And if it leads you to having a partner and having a baby, and if it leads you to a baby without a partner, you can be happy doing any of these things if you have set your mind to being independent, being resilient, and getting through finding the things that you actually really enjoy. So again, I wish your generation didn't feel the same pressure that ours does, but I suspect you still do, because I see it. Okay. Do people feel nervous about visiting the gynecologist? All the time. I mean, I like to believe they don't feel as nervous about seeing me because, I try to make them feel comfortable. I've known them for a long time. I don't wear a white coat, not because of nerves. I just don't like the way the white coats look. And so I think they feel nervous, and I think the onus is on us as women and as physicians and as men, if you're going to be a doctor or an OBGYN. My partners are actually, again, despite being men, they are such engaged doctors that like my patients love the guys too. I think it's different. I think they sometimes just want to talk to me because, as I joke, I have a vagina and I can talk about it and I've been through this stuff and that's helpful. But I think, yeah, women are very nervous to see their gynecologist, rightly so, right? It's a vulnerable position to be in, no matter how kind and gracious we all try to be. You know, you're lying there in like a paper or cloth gown and you're a little bit cold and you don't understand what speculum is and all those different things. So I think the more we can all interact kindly and graciously and talk to patients and make them feel comfortable, which is why Instagram has been great. Like, this is why I talk so much. Last night I did a post about TMI, how yesterday, like 3 patients were like, something really embarrassing about my discharge and my odor. And like 3 more patients were embarrassed about hemorrhoids. And I joke, like, this is literally stuff my children could probably talk about to my patients now because they hear me talk about it on the phone so much. So I think the onus is on all of you guys as future doctors, whether or not you're an OBGYN, to make your patients feel comfortable. We all have to remember, when patients enter into any medical facility, they are inherently nervous, right? Whether or not it's a well visit or not, there's a little bit of nerves and anxiety. People have angst and nerves about their health. So whether or not you care about talking to people, I really feel like if you are super smart and super sciencey and super good at that, then please become a PhD and please do not go into medicine. I really feel strong. Like, the one thing I feel really dogmatic about is when I see people who are and it doesn't matter that you don't have to be an introvert or an extrovert. You can be an introvert and still be very gracious and kind and quietly engage with your patients in a way that makes them feel comfortable. But the one thing that I feel really strongly about is people should not become practicing physicians face to face with patients if they don't enjoy talking to people, because there's too much room for creating lifelong problems for that patient and kind of scarring them into not thinking that they can like go back to the doctor or not feeling like they can be honest with doctors. So that's really, I think that's a really strong, like, important point. Okay, how much time do we have? I think we should talk about, I mean, I wish I could crack this code about what to do about maternal mortality in the Black population. It is clearly a big issue. It's gotten a lot of media attention because it's rightly so. I think there's so many different factors. Obviously, I personally cannot solve it. My own ideas that I see are that it partially has to do with socioeconomic status and partially just has to do with what we all know about inherent bias. I know that in our practice, I'm really proud of the fact that, like, we took Medicaid before anyone else did. So we have a varied practice. We're in a very wealthy, affluent county, but we also have a big population of people who take who use Medicaid, who are either American born or immigrants. And I know for a fact that we treat every single patient the same way. And I don't even actually know who has Medicaid and who doesn't, because it's surprising these days. And so you can't make assumptions. So I know that in microcosms, we treat patients exactly the same, but I also know that there's a lot that we don't know about physiology in people who are African-American. I like to just say Black, by the way, because a lot of my patients are actually from Africa and they're not African-American. They're literally from Africa and they're here. And they're an interesting group to me because I've learned so much from them. Many of them are incredibly educated and here for work. And so when they're here, they're the ones helping instruct us. Oh, hold on, guys. Sorry. How do I stop that? They're the ones who are helping me understand that we really have to be clear. Even using the term African-American, I think is a challenging term because it's not always so accurate. But I can see how the way people are approached and just the inherent bias that even those of us who consider ourselves to be very open-minded, what we don't even realize how much we're groomed by what we've seen. And so I think it's a huge challenge. And I obviously, politics aside, I'm very glad of what's going on right now in the current election, meaning I'm glad at the outcome, though I'm not happy with how it all turned out. And I'm not happy at what we know about a lot of people in our country and their own non-inherent bias, their very flagrant bias. And I'm hoping that that's going to change at some point. So without being too detailed, yes, there is a thing. I mean, I can see how people are treated differently based on the color of their skin still. And I wish I could say it didn't happen, but it absolutely happens in subtle ways and in very aggressive and overt ways, for sure. Same thing with how women are treated. Women are still treated differently, good or bad. It's happening. And I think that as we have more women in positions of power who don't feel like they have to behave in a masculine way. The beauty of being a woman is our feminine side. The beauty of many men is their feminine side. So if more men and women can get in touch with their feminine side, and as I joke, like, they can mother without being a mother, like mothering our world and mothering our communities and mothering our practices and everyone is actually going to lead to a lot more peace in our world. And hopefully we'll also solve the maternal mortality issue. Okay, the rest of these were pretty much the same stuff that we talked about. So is there any other questions that I didn't answer?
So, well, first of all, I don't know if you can see the chat, but people were on the West Coast waking up at 5:30 for this, and they said it was so worth it, that this was an amazing, inspiring talk. We have a couple of mothers in the chat.
Yeah.
So everything that you touched on was amazing. I think one of the questions at the beginning was, what advice do you have now for college pre-med students to get involved with COVID going on and kind of in the unforeseeable future? We don't know how long it's going to last. One can start getting back into our activities.
No, here's the truth. I guess the honest answer is I just don't know how much you can do. I think these types of things, it's so impressive that you guys have started this. I'm again amazed as young women. I was still like partying and trying to figure out what I was going to do with my life, and you guys are doing this. So it's amazing. So I think this helps. Listen, I've had people ask me if they could shadow me. And like recently I said to a young woman who's in high school even that I can't have her shadow me, frequently. And I actually have said no to like PA students, medical students, all those students, just because the way I practice is busy and I try to talk really in my patients. And so it just changes the flow. That said, like I have a high school student who in a couple of months is going to come in, just for the morning. And I might not have her come into all the patients' rooms, but listen, her mother's willing to let her take the risk and I'm willing to let her take the risk. She'll wear a mask in my office and she'll at least just see what it's like for that nugget of like 3 to 4 hours. So I think that's something you can ask. Like I assume and hope that some of you guys have doctors in your lives, whether it's like your own doctor, your own pediatrician, your own gynecologist, your own internist, relatives, and just say, listen, if I wear a mask, you mind if I just sit in your office, like literally just sit in the background and just watch the flow. I see what it's like. Unfortunately or fortunately, that might actually make you be like, this is great. It seems so fun. Like our office is a lot of fun and the drug reps love coming in and like they bring us coffee and my partners and I have fun talking. There are other days where people would probably be like, holy hell, I don't ever want to do what that woman is doing all day. But I think you also have to get a realistic view of what's going on in medicine. Like, we don't want to do the bait and switch. So I think that might be nice. I have to be honest, I'm not sure that that's so important. I know it sounds good to be like, we should all get all these experiences where you go into people's offices. But like I said, I didn't do any of that. I did not shadow an OBGYN. It was gross to me. I was not going to do it. I knew my own gynecologist who I had to talk to a lot because I found out I had HPV when I was 22 and taking my pre-meds. And it was like really like one of those things that I need to like write a book about. And it helped form how I talk about HPV to my patients and what not to say because the things people said to me were wrong. But that was it. That was my OBGYN. That was my intro to it until I was in medical school. So I guess my advice is like, I know like you're all supposed to stress out about like what you do so you can, tell everyone that you've like shadowed people, but I don't find that to be as valuable or necessary. I think you would do better. I'll tell you what I would want in someone I'm going to hire. Someone who's had a real job. Like I joke, if you could be a Starbucks barista, I will hire you and you can work in my office, right? So I think having a real job that teaches you grit and how to like, I hate the word hustle, but hustle and take care of a lot of different things at once will serve you so much better than going and finding an OBGYN to shadow, right? That's my view.
Thank you so much. My mom also said the same thing. She said everyone should work at a McDonald's before going into a
true. It is so true, honestly.
I guess, so we're right about done, but I guess just one more question. There were several people throughout the session just wondering about like building a private practice. So like, did you interview with this private practice when it was established, or what if you wanted to make your own? If you could just talk just a little bit about it.
It's a great question. And so basically I was lucky because I did my residency at Stamford, and it was my chief resident was actually, when I was an intern, my chief resident is now my partner. So meaning he was graduating. Dr. Gennaro, who started our practice 35 years ago, was solo. He hired Dr. Pat Cahill, my partner. And so I was like halfway through my intern year. And I remember saying to Gennaro, I really want to work for you guys when I graduate. And then you just hired Cahill and you're going to hire me next in 3 years. And he said to me, he's so funny. And he's like truly the kindest person. But this is an example of things that you hear. And he meant it genuinely, but also is such a kind person. He said, I'm never going to hire you because you're a woman, you're going to have babies, and then it's going to mess up the practice because you're going to end up leaving to have babies. And he didn't even mean it offensively. He's just one of those guys who says it like it is. And the frank truth is, he's actually right? I said, you are right. I'm a woman. I'm going to have babies. It's not going to mess up the practice, but you're right. I'm going to take maternity leave and I don't know how many kids I'm going to have. And guess what? You're still going to hire me. Just watch. 3.5 years later, we joke that he hired me and I was like, signed my papers, and then I was like, here's my positive pregnancy test. And he was like, I fucking told you were gonna have babies. And I'm like, yeah. And I told you I was gonna have babies. And guess what? It didn't mess up the practice because all those maternity leaves I took, which by the way, I took 3, they weren't the longest maternity leaves. They were like 7 to 10 weeks each. But what they've gained from me being a female physician is so much, and they know it. So it's like anything else. Have they taken the amount of time off that I have? No, because I also had the cancer where I took off 6 weeks for surgery. But they also know that they get so much direct and indirect benefit from me being a woman, that's the other thing we have to realize. It doesn't have to be equal. So I was lucky that they had already established the practice, but luckily I enhanced it and I changed it and I became a partner with them. And I've actually veered it in a lot of ways to make it organized. But to answer your question, yes, people start practices nowadays. It is not easy because, again, you have to have some business acumen. You have to understand a lot about the details. And I don't have the time. Like, I see a lot more patients than our senior partner. So he does a lot of the business details, and then I run the practice in other ways. But there are also really interesting different types of practices nowadays. There's one called DPC, where it's direct primary care. I don't know if you guys have heard of it, but you start a much smaller practice with a much more limited patient population, but you end up charging them a monthly fee, and then you really get to know your patients in a different way. So again, there are so many different ways. And you guys are far away from that. So honestly, I mean it. I think if you know you want to start a private practice, the answer is yes, you can do it. If you're not sure, I would not worry about that yet, because you have so many steps between now and then.
Thank you so much for all your nuggets of wisdom. There were some people, and I was joking with them, we just want to move to Connecticut so you can be our
Yes, come to Connecticut. Come shadow me, and
Yeah, we're all going to take a trip.
yeah. Okay, so my ask is to go on Big Love Fierce Juju. That's my regular Instagram.
Put it in the chat.
Talk about all the vagina, and go on Tribe Called V. So that's what we're going to be launching in the next week or two. And it's our first product is a pregnancy kit for telehealth calls, but the rest of it is going to be gynecology stuff. And so tell your friends. I think like my biggest take home is whatever it is you guys decide to do, you can do it. And it sounds so silly and small, but you can do it. And really, really try to remind yourself that life is long. And I say that despite having had cancer. When people are like, did you learn life is short? I always say, no, life is long, and I'm going to live the shit out of it. And that means I'm going to work hard. Like, I don't get to do all the things I do by not working hard. I work hard, but I still get to have fun. I still go out with my friends. I still see my kids. I don't exercise, which I should, but I do all the other things. So you guys get to choose what things you want to do. All right.
Thank
you so much.
Right. Thank you.
We hope you have a great rest of your day.
Thanks so much. Okay, guys, good work. Thanks so much.
Bye.